Today we're going to review hepatitis B testing in detail, including what each test means and how they're used in real clinical situations. Hepatitis B virus, or HBV, is a DNA virus that infects the liver. It can cause both short-term illness, known as acute hepatitis, and long-term chronic infection. The body's immune response and the virus's activity show up in blood tests called serologic markers. These help us diagnose, monitor, and make treatment decisions. Let's break down the main hepatitis B tests. HBsAg, or surface antigen, means the virus is present, either as a new or ongoing infection. Anti-HBs, or HBsAg, shows immunity. This could be from a past infection or from getting the vaccine. Total anti-HBc, or HBcAb total, means the person has been infected before. It doesn't appear in vaccinated people. IgM anti-HBc, a specific type of core antibody, points to a new infection or a flare of chronic hepatitis. HBeAg indicates high levels of the virus and that someone is more infectious. Anti-HBe, or suggests the virus is less active and less likely to spread. HBV DNA measures the amount of virus in the blood. It's used to guide treatment and track progress. Now let's look at common test result patterns. If someone has acute hepatitis B, they'll usually have HBsAg, IgM anti-HBc, and possibly HBeAg and HBV DNA. Anti-HBs is negative. If the infection is resolved, HBsAg is gone, but anti-HBs and total anti-HBc remain. After vaccination, only anti-HBs is positive. All others are negative. In chronic hepatitis B, HBsAg stays positive for more than 6 months. Total anti-HBc is also positive. Depending on the stage, you might see HB anti-HBe or HBV DNA. The window period is a tricky phase. HBsAg has disappeared, but anti-HBs hasn't appeared yet. The only marker might be IgM anti-HBc. In occult hepatitis B, HBsAg is negative, but total anti-HBc is positive. Low levels of HBV DNA might still be present. This matters in patients with weak immune systems or those receiving transplants. Now, how are these tests grouped in practice? A screening panel usually includes HBsAg, anti-HBs, and total anti-HBc. An acute panel, IgM anti-HBc. For patients with chronic HBV, we monitor HBsAg, anti-HBe, HBV DNA, and liver enzymes like ALT. When should you order hepatitis B testing? When liver enzymes are high without explanation, before starting chemotherapy or immunosuppressants, before using medications like TNF inhibitors, during pregnancy, in higher risk groups like IV drug users, men who have sex with men, or people from countries where HBV is common, to check immunity status before or after vaccination, or when screening donors of blood or organs. If someone is on treatment, we focus on HBV DNA to track viral load, ALT for liver health, and changes in HBe or HBsAg to see if the virus is becoming less active or disappearing. Here's a quick guide to interpreting test results. If only anti-HBs is positive, they've been vaccinated. If anti-HBs and total anti-HBc are both positive, they had a past infection and recovered. If HBsAg and total anti-HBc are positive but anti-HBs is negative, the infection is active. If only total anti-HBc is positive, think about the window period, an old infection or occult hepatitis. If just HBsAg is positive, it may be a very early infection. If all markers are negative, the person is still susceptible. In summary, hepatitis B serology helps us understand the stage of infection, immunity, and need for treatment. But results should always be interpreted in context, taking into account symptoms, risk factors, and liver function tests. That concludes our comprehensive review of hepatitis B testing.